Hello everyone. Today I am presenting the topic chemical examination of urine, sugar and ketone bodies. Introduction to urine analysis. Chemical examination. Urine analysis is one of the most common clinical laboratory tests. Chemical examination involves the detection of various metabolic substances that are typically absent or present in trace amount in normal urine. Abnormal constituents like glucose and ketone bodies provides vital clues regarding metabolic disorders, primarily diabetes mellitus. Key analytes of interest. Urinary sugar, mainly glucose. Its presence is termed glucosuria. Occurs when blood glucose exceeds the renal threshold. Ketone bodies, acetone, acetoacetate, and beta hydroxybutyrate, the products of incomplete fat metabolism. Today I am speaking sugar in urine, glucosuria. Defining glucosuria. Glucose is filtered by glomerulus but is almost completely reabsorbed by PCT of kidney. Glucosuria is the excretion of detectable amount of glucose in the urine. Normally only minute amount are passed which are not detected by routine test. Mechanism. When blood glucose level exceeds this threshold, the capacity of the renal tubules to reabsorb glucose is saturated. The excess glucose spills into the urine. This is the hallmark of uncontrolled diabetes mellitus. Clinical significance. Diabetes mellitus, most common cause due to insulin deficiency or resistance. Elementary glucosuria, temporary appearance after heavy carbohydrate meal. Renal glucosuria, blood glucose is normal but renal threshold is lowered. Endocrine disorder, hyperthyroidism, Cushing syndrome and stress. Benedict qualitative test. The principle is glucose contains a free aldehyde group making its reducing sugar in hot alkaline medium. Glucose reduces cupric ion to cuprous ion. This forms insoluble cuprous oxide which precipitate as colored compound. Here the blue color solution is having no sugar in the urine and the trace of reducing sugar present in the green precipitate and the moderate amount of sugar is present in the orange red precipitate and the large amount of reducing sugar present in the brick red precipitate. The procedure: first you have to take 5 ml of Benedict reagent in the test tube and then we have to add 8 drops of urine sample to the tube and then we have to boil the mixture over the flame for 2 minutes and we have to cool the test tube and observe for any color change or precipitate. Here in this slide we are discussing of the interpretation. The table shows the color of the solution changes according to the amount of reducing sugar present. As the sugar concentration increases, the color changes from blue to green, yellow, orange and finally brick red. Here the green color precipitate shows this trace amount of sugar is present in the urine. It's less than 0.5 gram per deciliter. Green color, the yellow precipitate, shows a moderate sugar present in the urine, 5 to 1 gram per deciliter, 0.5 to 1 gram per deciliter. The yellow color precipitate shows mild amount of sugar present in the urine. The brick red precipitate, sugar is more than 2 gram per deciliter, indicates the high amount of the glucose present in the urine. The reagent strip method. Glucose oxidase principle. Modern labs use plastic strip coated with enzyme. This method is specific for glucose. The reaction: glucose oxidase catalyzes glucose to gluconic acid and peroxidase. Peroxidase then catalyzes H2O2 to react with the chromosome to produce color change. Highly sensitive and eliminates false positive for other reducing sugar like lactose. I am speaking ketone bodies in the urine. What are ketone bodies? Acetoacetic acid, beta hydroxybutyric acid, acetone. Clinical significance of ketonuria. The major causes: diabetic ketoacidosis, a life-threatening emergency in type 1 diabetes; starvation, forced fat metabolism due to lack of food intake; severe vomiting, loss of carbs; strenuous exercise, rapid depletion of glycogen. The Rotaras test. The principle: ketone bodies reacts with sodium nitroprusside in the alkaline medium. This reaction forms a permanganate color complex. The test is highly sensitive, detecting a little as 1 to 5 mg per deciliter of acetoacetate. Procedure: first we have to saturate the 5 ml of urine with ammonium sulfate crystal. Then add small crystal of sodium nitroprusside and mix well. Slowly add liquor ammonia down this side and observe the purple ring at the junction of the two liquid. In this slide, we are here interpretation of the Rothras result. As there is no color change, there the reporting is negative. There is a deep dark purple ring appears this positive reporting. Note on sensitivity. Rothras test does not detect beta hydroxybutyrate, which is most abundant ketone. However, it is excellent screen for acetoacetate. Gerhardt's ferric chloride test. Principle: the ferric chloride reacts with acetoacetic acid to produce red color. The note: this test is less sensitive than Rothras and gives false positive with salicylates. Aspirin. To confirm, boil the urine. Acetoacetate is heat level and color will disappear, while drugs are heat stable. Quality control and precaution. Use freshly wired urine for best result. Always check reagent expiration date and store Benedict reagent in a dark bottle. Handle liquor amine with care. Maintain proper boiling time for Benedict test to avoid false negative. Confirm strip result with the liquid test if significant pathology is suspected. Thank you.